Good morning. I call to order the February 25th, 2020 meeting of the Saline County Board of Commissioners. Will the clerk please call the roll?
Commissioner Shadwick.
Here.
Commissioner Sparks.
Here.
Commissioner Vidrickson.
Here.
Commissioner Weiss.
Here.
Commissioner White.
Here.
I ask that you please stand, join me in a flag salute, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We now move to the public forum where citizens may speak on county government, usually limited to 3 minutes, items that are not on today's agenda.
Norman Salina. I attended a court hearing Friday upstairs, and the subject was brought up about the jail issue. And the statement was made in the court that building a new addition, the system we got in place is not working. You're going to have to find something else besides putting people in jail, because what you got ain't working. Sending people to treatments after they're in jail, you're going to have to do it before they get to jail.
Thank you. Does anyone else wish to address the commission? Seeing none, I'll bring it back to the commission for regular business. The consent agenda, are there any items that any commissioner wishes to pull from today's consent agenda?
Nope.
Hearing none, the consent agenda will stand as approved as written. Item number 1.
RFA 131-20 Federal Funds Exchange Program with Justin Mader, County Engineer.
Good morning, Justin.
Good morning, Commissioners. I've got a request for action to approve the 2020 Federal Fund Exchange Agreement with the Kansas Department of Transportation. Saline County will be receiving approximately $273,942.85 in federal funds for the 2020 year. This agreement converts those federal funds to state funds at a 90-10 exchange rate. The alternatives for action is to, number 1, sign the agreement and convert the funds to state dollars, which will make the funds available to Saline County through a transportation reimbursement program. The second alternative would be to not sign the agreement and leave the dollars as federal funds. These funds then can only be used through a federally funded project procedure through the Kansas Department of Transportation. Staff recommends that the Commissioners sign the agreement. Budget impact: exchanging the funds will provide $246,548.57. That's the 90% exchange rate for any type of transportation-related project. In the past, these funds have been placed in the 125 account, which is a special bridge funds, and have been used for to replace bridges for that year. However, this year I'm also considering to place those funds in the special highway fund to help with some asphalt road maintenance projects as well. So there's some additional needs that I'd like to use those funds for.
Justin, the exchange rate going from 75% to 90%, at the bottom line, are we getting more money or not?
Okay, bottom line is, so last year we had a 90, I'm going to compare it to last year, okay? So last year we had a 90-10 conversion rate. And I went back and looked.
75, wasn't it, last year?
That was the year before.
Okay.
The year before it was a 75-25 exchange rate. Last year it was a 90-10, just like it is this year. So in 2019, we received, as far as the amount of federal funds, we had $320,498. This year, we've dropped 85% to $273,942. And so I called KDOT up, asking them about the why we have such lower federal funds, and the reason for that is, number 1, they've had some higher expenses. So those federal funds, before they're distributed to counties, there's several programs that pull from the top of that fund before they're distributed, and one of those is the load rating program. So all the bridges, county bridges, which you're looking at over 19,000 structures, are having load ratings performed on those by a consultant. The cost for that program has been a little bit higher than normal. Also, the state has received less federal funds than what they've had in the past. But then also another thing that's coming into play with this is that they're coming to the end of the FAST Act. And so they're having to balance some programs, some of their program accounts out. And so since there's been kind of a deficit in the load rating program because it's cost more, they're having to balance that out by taking away more of the distribution to counties to pay for that.
Okay, thank you. Comments from commissioners?
Yes, is this gas tax money? Is that how the federal program is funded?
Yeah, there's some of it that's gas tax. I'm not exactly sure what all goes into the funds, the federal funds for this, but I know gas tax is a big part of that.
Okay. And do we budget for this? Or is this a windfall for us, or do we think, oh, we're going to get something every year?
Yeah, no, we've budgeted. It's
Okay.
been pretty consistent.
Okay.
Now the money that we get, the federal funds that we get from from KDOT, these federal funds, they're not guaranteed money.
Right.
But it's been pretty consistent that KDOT has always provided. I believe it's around $30 million a year to counties for this, and they've done that for a long time. And I don't see this program going away at all. So it's pretty consistent, and I think we've depended on this, in the past and as well as this year.
That brings me to another question. When do we get this money? I mean, once we sign, assuming that we sign this agreement, how long does it take us to get that money, number one? And number two, does it go into the 2020 budget, or do we have to wait for 2021?
No, it goes in. So how this program works is as soon as the agreement's signed, and then those funds are converted to, in a sense, state funds, okay? The only requirement on those funds then is that it goes to a transportation-related project, okay, through a reimbursement program. And so what we've done in the past is we want to get our money away from KDOT as fast as possible, okay? So what I'll do is I will pick a project that has already been planned and bid, for instance, like our chip seal projects. I will use our chip seal program and to the payments to the contractor for that to get our money from KDOT. And then what we'll do is then we'll take that money and put it into another program, one of our special projects. Like I said in the past, it's always been to our the 125 account for a special bridge, and then we'll use that money to pay for a structure. And then, but this year, what I'm considering is putting it into the special highway fund because there is some highway maintenance that I think that I would rather not defer for another year. However, I need some more money to cover all of our needs than what's been budgeted, and so I can use that money to pay for some of the additional maintenance.
But the bottom line, the money does come to us in a timely fashion.
Yes.
It's not a FEMA thing that takes 2 or 3 or 4 years to get your money.
Yeah, as soon as I submit there's another form, a reimbursement form, and I've got, proof of that expense, they'll usually get a check cut to us. I think it's direct deposited actually within a month.
Okay. Further questions or comments from commissioners?
I think you already answered my question, but for clarification purposes, so this money will not roll into the special bridge fund? It will go into the special road fund?
For this year, I would like to roll that into the special road fund to help with some maintenance.
And that can be swapped
Yes,
from one fund to the other?
we can put it on anywhere we want as far as the special projects.
Thank you, sir.
Any others? Is there any public comment? Seeing none, I'll bring it back to the commission for action.
Mr. Chairman, I move we approve by signature the 2020 Federal Fund Exchange Agreement.
Second the motion.
It's been moved and seconded that we approve RFA 131-20 Federal Funds Exchange Program. Further discussion? All those in favor of the motion, please say aye. Aye. Opposed, same sign. The motion does carry. Item number 2. Thank you, Justin.
RFA 132-20, bid award for a tanker with David Turner, Rural Fire District Number 5, Chief.
Good morning, Chief Turner.
Good morning, Commissioners.
About a month ago, Saline County District 5 went out for bids for a pumper tanker. Sealed bids were opened on February 4th, and we received 5 bids. I'll start with the lowest bid was from Hayes Fire for a Rosenbauer pumper tanker for $263,789. Wise Fire for a towing apparatus for $269,162. Danco Emergency Equipment for a pumper tanker for $292,951. Feld Fire for Spartan ERV, $317,216, and then Conrad Fire for a Pierce was at $341,669.15. Staff has reviewed all the bids from the vendors and would like to award the bid to Hayes Fire for the Rosenbauer pumper tanker for the low bid of $263,789. Rosenbauer's bid did meet the department's specification and exceeded it in many of the areas that we had identified. And staff would also recommend approving the lease proposal from Community Leasing Partners for the total amount of $263,789 for 10 years. As previous RFA, Community Leasing proposal identified the best rate factor was 0.118695, as well as the lowest APR of 3.24% for the county. Budget impact, like I stated before on the RFA, there's not going to be much of a budget impact. We paid off a tanker last year for about $25,000 annual payment. This annual payment is increasing a little bit to $28,486.79, but we've identified that in our budget and have adjusted it accordingly. With this, we will be putting down a $25,000 down payment this year, and then our first annual payment will be due in 2021.
How quickly will they deliver this?
About 345, 360 days.
So a year, pretty
About
close to a year.
out.
What is and I know you can't tell me exactly, but the life expectancy, would you hope that you get 20 years out of this, or 15, or?
20 years is the NFPA cycle anyway.
And the equipment that it's replacing, will you try to sell that, or what goes with that?
I'll try to offer it up to a county department in the area first.
I know that Gypsum was talking about one, or Rural Fire District Number 1, not Gypsum, but was looking.
District 3 is also interested in it, so.
Okay. Further comments from commissioners?
Chief, you, knowing that there could be some radio purchases in your future, have you earmarked any monies or set aside any for radio replacement?
Yeah, we identified that a couple of years ago and set a separate line item in our budget of $12,000 per year that goes into our radio budget. Plus, we have roughly like $69,000, $70,000 in our special equipment account. So I think we're going to be doing good on radios.
Very good.
Good. Further comments from commissioners? Questions? Is there any public comment?
Chief. Norman Mountain, Salina County. Do we back charge people when we go out there to do these emergency calls?
No.
In other states, we do. Colorado, I've been up there.
We pay tax dollars for that.
Well, they pay taxes up there too, but still, when they go out on an emergency call, they're going to start back charging people for having these emergencies. I've seen it done in Colorado. Why don't we do it here?
There's a lot of things in Colorado that we don't do here.
Yeah, we're going to do it though.
All right, further comments from the commissioners? No. All right, hearing none, I'll ask for a motion.
Mr. Chairman, I move we award the bid for a Rosenbauer pumper tanker to Hayes Fire in the amount of $263,789 and approve by signature the lease with Community Leasing Partners as requested.
Second.
It is moved and seconded that we approve RFA 132-20 bid award for a tanker for Rural Fire District Number 5. Are there further questions or comments? All those in favor of the motion on the table, please say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Chief, for coming, and thank you for your due diligence on the bid process.
Appreciate it.
Thank you. We'll move to item number 3.
Health Department update with Jason Tiller, Health Department Director.
Good morning, Jason.
Good morning, Commissioners. So this update covers July through December 2019. As always, there's more than one way to connect with us at the Health Department besides coming in, Twitter, Facebook, Instagram. So even though I bring this up each time just as a reminder of what our mission at the Health Department is for those that are at home that are seeing this, but more importantly, our vision is to be a leader among Kansas cities and communities. As you can see, if you remember right, we've had a couple of changes in the leadership team in this past year, and that reflects with the changes in staffing we've had this past year. So I'll leave this here just for a second for you to look at that. But we've had a lot of comings and going of staff that have retired, promotions, and then backfilling many of those positions. So on to the program updates. So in child care licensing, they finished out their 100-year celebration of child care licensing here in Kansas. Attended the back-to-school fair this past year and engaged 250 families. And then as part of their continuing education for child care providers and for the State Association of I'm sorry, I just drew a blank on what the EYC part of that acronym stands for. But they did an active shooter training with them in this past 6 months as well. These are their visits over the 3 counties. If you remember right, they cover Saline, McPherson, and Ottawa for all regulatory visits for annual licensing, any types of complaints, annual inspections, new facilities, home daycares, etc. Maternal child health. With their Becoming a Mom program, they had 469 participants in the 6-month period. They've also began collaboration with Central Kansas Foundation so that they can meet with prenatal and postpartum mothers who are receiving treatment at the facility about their education and training in motherhood. And they were also identified by the National Institute of Children's Healthcare Quality as one of 4 Kansas counties for best community collaborative practices. So our program here, Becoming a Mom, has been recognized not only statewide for its impact, but as well as nationally. And this is just the breakdowns of their different types of visits over this past 6 months. Our clinic has seen some changeover in staff as well. The annual community flu clinic, we had almost 500. We were 1 away from that this year, but 182 outside, 317 inside. And this year we actually had a lot more kids come through and get their flu shots than we have in the past, which is great to see. Diane Pancake, who is our HIV case manager, was named the 2019 HIV Case Manager of the Year. We did have to go out and do a vaccine clinic at the Salina Mission for hepatitis A prevention. And then we had a pretty in-depth tabletop exercise on active shooter response that was also resulted in having people do a hands-on walkthrough of each of their office areas and look at things like how to get in, how to get out, where to hide and barricade themselves, and identify what kind of things that we need to look at improving as far as security. Now, through all the multiple areas that we see clients, of course, immunizations over this last 6 months, brings up a lot of that. That does include the flu shots that we have been doing this past 6 months, which for the first time in a couple of years, we actually ran out of regular flu vaccine this year. We didn't have to send any back. We still have some high dose, but we used up all of what we had ordered as far as regular flu vaccine. Epidemiology, these are the disease investigations over the last 6 months. I had to put elevated blood lead and animal shelter bite reports over to the side because, quite frankly, putting them on the axis messed it up so much to where you couldn't see some of the smaller numbers and actually be able to see what was going on there. And this all represents individual cases that have been investigated in the past 6 months by my 1.5 disease investigation staff. And this does not reflect, though, any type of contact reports that they've had to. So if one was an infectious disease and they had to contact anybody that may have been exposed and having to do those additional contact investigations. In home health, they have spent quite a bit of time as Medicare has made some changes to how they are doing billing with this patient-driven groupings model, and preparing for that and the education for that. It took Medicare billing from a 60-day, what they call a 60-day period, down to a 30-day period, which increases the amount of paperwork that's involved with the billing. They completed 13 outreach flu clinics throughout the county, as well as have been providing quite a bit of service to the seniors over at the senior center. I've been working with Rosie over there to provide different services as I have listed here. This is just a breakdown of their visits over the last 6 months. In WIC, don't let the giant drops in number or the chart here disturb you. Really, it's only about a difference of about 50 or so with the way their numbers have been in the last 6 months with their active caseload. Each summer they do outreach at Head Start during their enrollment period. They establish a breastfeeding room in the WIC area so that the breastfeeding peer counselor can work with mothers one-on-one in a better setting. And as part of improving health literacy, have started a WIC story time group to help with that literacy part. Their visits for the last 6 months. And then under preparedness and health education, there's been lots of information out there about this new coronavirus. The biggest thing that most people can do is really the same things that they do to protect themselves from the flu. Stay home when they're sick, wash their hands, cover their mouths when they cough. We have made preparations in case or in the event that a case does show up here, but that has not been we have not had that event yet. Coming up, of course, is going to start getting warm again. So mosquito prevention for West Nile and other types of diseases that are carried by mosquitoes. And we will start putting information out again coming up here the next couple of months about draining those excess or those areas of excess standing water, addressing to prevent bites, and using DEET. We also went through recently, not only in response to this coronavirus, but we have the full-scale exercise that's coming up in April that will be done statewide, and we are one of the communities setting up a full-scale point of dispensing operation as part of this exercise. So we did a complete revamp, complete gut and revamp of all of our public health preparedness materials, boxes, and everything like that. One of the things kicking off this year, I mentioned this is coming up, is that if you will remember, last month you signed the paperwork for the Overdose Data to Action Grant. And so we'll be kicking those initial meetings off first part of April to look at gathering all of the data. I've been working with Central Kansas Foundation on getting some of the preparations set up for those assessment meetings, and then looking at how we can better be able to get a good picture of overdoses in the county and how that's working, and the strategies and better communication is all part of this grant. So there'll be at the my next update, we'll have some more information on how that has started working out. Administration, Just a couple of project updates. So if you remember IRIS in the past, that is the Integrated Referral and Intake System. We are continuing to add additional agencies in the community. The adoption has been a little bit slower than I had hoped for. Lots of people are on board with the idea, but it does come with adjusting some workflow processes in their internal organization about how they do referrals. And I think that has just been some of the figuring that part out and really being able to use this better. We have had that 36 referrals that have been completed through this process or through this system. We've recently brought on Salina Family Health Center, and then in conversations with a couple of other agencies that are commonly part of this referral network already, informally, and this will help formalize that and make it more efficient. Just a quick update from CALD. This year I am the board president of the Kansas Association of Local Health Departments. One of the things that we've really started working on as an association this year is engaging the legislature and developing templates for local health departments to be able to use as far as providing testimony on certain types of legislation and education and training on how to do that. And one of our main pushes this year, which has recently been given its House Bill number 2714, is to modify the state formula funding that's provided to health departments. That's pretty much the only discretionary funding that we get through all of our different aid to local grants. And it hasn't been updated since the early 90s. Right now, every county gets a baseline $7,000, and then there's a population adjustment amount on top of that. And for this legislation that we have been working on as an association, we'll change that base amount to $15,000, provided that the funds are available in KDHE's budget so that we aren't stealing from other counties just to raise that minimum number. So this is kind of the first push that CALD has done in quite a while to do some legislative work, and so it has been an interesting and learning process about how all these different committees work and how bills get pushed through and how it has just been one of those things that was just like, wow, I had no idea what kind of stuff it takes to get a bill or something like that introduced into a committee and so forth. The advisory council, of course, we've added the 2 student positions. We haven't received any expression of interest forms for those yet. So if anybody out there is listening, knows of a high school student that is sophomore higher or college level undergraduate who might be interested in serving on the advisory committee, they can go to saline.org and fill out the expression of interest form. If they have questions about it, they're welcome to contact me at any time. And then lastly, just kind of looking ahead, of course, our aid to local grant applications will be due mid-March as they are each year. We'll be internally reviewing and updating our strategic planning documents. And then, of course, budget planning and preparation will be coming up here, and we'll be getting all of that information together for each of you to review.
All right, thank you. Jason, congratulations on being named president of that organization. I think that gives us 4 or 5 of our department heads that are presidents of the state organizations that they belong to. So I think it speaks pretty highly of our staff that we have in position for our department heads. And early on in your presentation, you mentioned your staff. What is a full staff and numbers of people for the health department?
Full staff right now is 36 total.
36, and are you full?
We are, but we do have some transition. We have one that's going to be leaving, and so we're going to be, we've actually already are advertising for that position, so I would like to finally get to where we have no staff leaving or coming, get completely stable, but
I get it.
We're getting close.
All right. Any other comments or questions from commissioners for Jason?
What basically is the difference between the flu and coronavirus? I mean, what scares people so badly?
Well, I think with this new coronavirus, a lot of it which is concerning is that just they don't know enough about it.
Okay.
So there's still a lot of unknown information about it, as far as really what all it can do. And so really, a lot of the effort is to try and keep it contained while they still learn more.
Okay.
And then the other part of it pretty much is that I think its impact is to similar to those that we see with flu, young, old, immunosuppressed, those that have significant health issues as far as people that are dying from it. And just in general, it's a new thing. There's no vaccine for it.
Okay, that's
So-
the other thing. So this didn't exist 10 years ago anywhere?
No, in fact, what I understand at this point is that this originated potentially, this is just one of the ideas, that it originated potentially as a animal-borne virus
Okay.
that jumped to humans in one of the open-air meat markets, if you will, because they have live animals sharing viruses that can cause it to mutate, allows it to jump to humans, get a foothold, and then that's where this one came from, likely.
Okay, thank you.
Any other questions? Thank you, Jason.
Thank you.
We'll move to item number 4.
County Appraiser update with Sean Robertson, County Appraiser.
Good morning, Sean.
Good morning, Commissioners. Good morning. Thank you for the opportunity to let you know what we're doing in the appraiser's office. Bye.
He was just there. Did he turn it off? Or?
Sorry
Go ahead.
about that. Anyway, the big thing, as you know, that we're required to mail value notices every year by March 1st. We will be mailing those value notices to property owners, as it says up there, February 26th. That will be tomorrow. So we anticipate that people should start receiving those by Friday. If not, then over the weekend, and those values should be available on the website beginning Thursday. Property owners will need to call by March 27th. They have 30 days in order to schedule a meeting with an appraiser to talk about their value. That it doesn't have to be held within that 30 days, but they need to call within the 30 days, and that is on their value notice that shows that. We welcome any information of which we aren't aware, and we actually value these informal meetings or hearings, if you will, because we want to be fair overall and to individual property owners. It is preferable both from an appraiser side, the county as a whole side, and a taxpayer side to discuss their value now in March at this time instead of tax payment time. The taxpayers do have the opportunity to appeal their value either in the spring or at the time they pay the taxes. However, the taxpayer will have to pay part of the taxes in order to get a hearing if they wait. At this time, they don't, obviously, because there are no taxes set on that value. And from a county point of view, if they have their hearing when they pay their taxes later in the year, then there is an abatement or refund process that has to be followed, whereas right now there would be no such thing. So we really encourage people to, if they have questions or have information that they would like to give us, to schedule the meeting now. We've also been working through our 2019 payment under protest hearings, which are the hearings we have when people pay their taxes. Any data changes that we find from those hearings, we've been applying those to the 2020 values. We're also in the process of hiring a field appraiser due to a resignation. This comes at obviously an inopportune time for our office with sending out values and having hearings coming up. But we are in that process. I personally have been working with Senator Hardy on a bill to help OCCK and with some of their property tax issues that they've been having. But with just like with any legislation, it shouldn't be geared toward a specific property or property owner. So in a more broad sense, this helps out other humanitarian service providers. I too am a president of our appraisers organization coming up, and I've been working with a lot of local entities to bring our 2021 state conference to Salina. It has never been here. It's always been generally Wichita, Manhattan. Try to stay away from the far eastern side because the western Kansas people just don't want to travel that far, but I don't think until recently we've really had the hospitality facilities to do that here in Salina, but working to bring that here in 2021. Some preliminary value overviews, and obviously this will change between now and certification, but just to give you an idea what we're looking at. New construction was up compared to the previous year. There is actually only one additional exempt parcel for 2020 versus 2019. I would like to note that of our total valuation in the county, approximately 20% of it, however, are exempt from property taxes. There are some changes to property classifications due to a review of vacant lots, partially to determine if those lots had new construction without a permit or without a permit that we received. The city went to a new permitting system, and there was a period of time where we didn't receive those from the city, so we've gone out and double-checked some of those. And then also checking for agricultural use purposes, which we review those every 2 years. Let's see it. Also, like to mention that overall values are stable, but it just depends on the area or the individual property. Just for example, there's a little over 11,000 individual properties that their value either went down or stayed the same this year. But that doesn't mean that overall the values have gone down. In fact, the downtown TIF district as a whole, the values are up approximately 20%. So it just depends on what type of properties and in what areas those are. The biggest measure that we have in order to grade our performance are ratios that compare our values as of January 1st to sale prices that occurred after that. For 2019 residential properties, there were 1,019 home sales, and our ratio of value to sale price was 100.1 on a percentage basis. Commercial properties, there were 67 commercial property sales, and our value compared to the sale prices was 100.0. So I think that shows that we are doing a really good job of setting accurate values on all types of properties. So,
All right.
if you have any questions, be happy to answer those.
I've just got an observation, and having watched the city commission meeting last night, and that is agricultural zoning within the city limits of Salina.
Right.
I mean, that always kind of leaves me shaking my head, particularly those that are well within the city limits and in surrounded by houses, and yet they're zoned as agriculture. And I assume that is a taxed at an entirely different rate than if something were zoned for single housing development.
Although we don't really look at the zoning, we do look at the use, and agricultural use is completely different than any other for two reasons. Number one, the county appraiser doesn't set the value for parcels that are being used for agricultural use. Those are set by the state. Also, they are not at market value. That was done decades ago in order to give farmers a break on taxes. The values are approximately 1/10 of what a market value would be. However, inside the city limits or small parcels, there is no restriction as far as the state is concerned on how small a parcel can be or where it's located in order to be used for agricultural use. And there are some individuals that have taken advantage of what some would call a loophole in that law, and that's certainly their right to do that.
Well, I'm certainly not questioning the taxation levels or how it's done in the county, outside of the city limits, and people that are actually have pasture ground or farm ground or whatever. It's just when I see a 5 or 6 acre tract within the city limits being zoned as agriculture, just waiting for it to be developed and escaping the taxation level that it should be, it leaves me shaking my head. So, anyway, I've said that, it's off my chest. Any other questions from commissioners?
Is there something proposed at the state level about vacant stores? Is that true or not? Or I've just heard it on the street about taxing them differently.
The short
the
answer
Kmart
is no.
leaves and it gets taxed differently.
Right. The short answer is no, but just an explanation of what that entails about vacant or dark stores. There has been a theory proposed mostly by some tax reps and attorneys for larger retail places. Their idea is that those properties will not sell until the large retail place, Walmart, Target, Kmart, those types of places, abandon them. And therefore, the counties should appraise those properties as if they have been abandoned. From a county appraiser point of view, what we look at is it's generally tied to location, the value. It's not that, let's just take Walmart or Target since they sit adjacent to each other. It's not that we are valuing any part of the business. We are valuing the structures that are there, but they are very valuable because of their location. That's the difference. There isn't anything proposed at the state level.
Okay.
It's just a difference in valuation that the county appraisers follow versus tax representatives and attorneys for some of these large retail places.
Thank you.
Any other questions? Not, thank you, Sean, for the update.
Thank you.
We'll move to item number 5.
RFA 133-20, declaration of no value for county property with Hannah Stambaugh, Deputy County Administrator.
Good morning, Hannah.
Good morning. This is a request for action for the Saline County Department of Senior Services. They have some access property that they wish to have declared no value and authorization for these items to be taken for salvage. Our county policy does allow for 3 different methods of disposal: donation, destruction, and sale. Rosie has got 3 items: a milk cooler, a steam table, and a Vulcan stove that are items that are completely beyond reasonable repair, and has requested for these items to be declared no value, and for those items to be taken to Salina Iron and Metal for salvage. Any type of proceeds that are gained from the salvage of those items would be placed in the general fund.
Questions? Nope. Is there any public comment? Seeing none, we'll bring it back to the commission for action.
Mr. Chairman, I move we declare the county property of no value and authorize the items to be taken to Salina Iron and Metal as listed in RFA 133-20.
Second the motion.
It's been moved and seconded that we approve RFA 133-20, declaration of no value for county property. I would suggest one thing maybe, or just a question. You're saying take it to Salina Iron and Metal. There are several different salvage companies in the area. I don't know if that needs to be bid in that fashion or not, or they're probably all in the same area as far as the price per pound and that kind of stuff. But
Yeah, we can have staff research that to kind of figure out what is going to be the best
a thought,
option. A lot of it has to deal with proximity. Those items are pretty large, so.
All right. Let's see, did you made the motion, Monty?
Yes, sir.
Is there a second?
I second.
Roger, second. I guess we're going to call for the question then. All those in favor of approving RFA 133-20?
Aye.
Aye. Opposed, same sign, motion carries. Item number 6.
RFA 134-20, interlocal agreement with the City of Salina for jail services with Philip Smith Haynes, County Administrator.
Good morning, Phil.
Good morning, Mr. Chairman, members of the commission. You may recall that this item came before you at the very end of 2019 for a short-term extension, and so we're back with a longer-term agreement between the county and the City of Salina. The county and the city provide different law enforcement services to each other, and as a result of the agreement, they sort of exchange money, and the net is a revenue to the county because the value of housing the city prisoners is a larger value than the other services that are provided in the agreement. That agreement, the values in that agreement really have not been addressed for over 10 years. They've been sort of allowed to float along under a consumer price index inflator. So in discussions with the city manager, we felt like it was time to actually investigate what the proper values for that should be. In the past, that has been done by use of an outside consultant, not something that either entity budgeted for this year. So we felt like really all the data that needs to be crunched is something that we could do internally. The proposal is to establish a staff working group that would come up with exactly what needs to be tracked, make recommendations to the city manager and myself, and then we would track that information starting July 1 of this year through June 30th of next year. That would give us a basis for negotiating a new agreement starting January 1 of 2022. The city did approve the agreement last night at their meeting, and staff is recommending that your commission approve it as well, and I would be happy to answer additional questions.
And this would run for how long?
22 months. It would be March 1 of this year through December 31st of next year. It also does provide for a month-to-month extension if we don't negotiate a new agreement by the end of it, so we won't be back in the situation that we found ourselves in December of last year.
We've been in those extended month-by-month or year-by-year contracts before, haven't we?
Well, not in the 3 months I've been here, but...
Well, I'm speaking of the Expo Center, is what I'm speaking
yes.
of. Just shouldn't have brought it up. Okay, questions?
Yes, Mr. Chair, and I'm not going to hold this up, and I'm not against it. I'm for the program. But I've got a couple questions. Number one is medical care. I see it. I've read through it and I see it, but just walk me through. Somebody has a heart attack and has to be taken to Salina Regional. That's not routine. That can cost incredible amount of money. And is that on the counties?
So the first thing to understand about this agreement is who we're talking about. So for somebody who comes in on a state charge, that's on us. Okay. The folks that we're talking about that the city reimburses us for are folks who come in specifically on city charges. So there's a definition of a city prisoner within the agreement, and then, as you mentioned, there's a definition of routine medical care. Something like a heart attack would be beyond routine. Right. So the agreement does provide for the city to reimburse for those expenses. And the city does, if you look at the actual billing on a monthly basis, it's not just this flat number. There is a charge that the city does reimburse us for extraordinary medical expenses and that sort of thing. Now, as a practical matter, if somebody had a heart attack, I think what we would do is try and get them released on their own recognizance so private insurance could pay for that. But in the absence of that, yeah, it would be a city charge.
And, when we were going through the jail reduction task force, our consultant that we had hired was surprised that we've had female inmates give birth. And he says that's normally not happening. It's normally what you just said, being released on their own cognizance and having somebody else pick up that tab. But so, those costs do happen. There's no doubt. The other one is 3F. It talks about transportation, and I know a lot of our costs because we have so many people being transported out of town. I'm not so sure I really got the meaning of that paragraph there.
So there's actually a reference in the agreement to another agreement that was entered into in 2006. And so I looked that up, and that is essentially the city reimbursing us for the cost when a city prisoner is transferred to a jail outside of Saline County.
Right.
So, yeah.
My last one is the amount. What have they been paying us in the past? I just don't have a recollection. And do you know what the city has been paying us in the past?
Yeah, so the amounts that are in the agreement are just the, are 2.1% higher than the amount that they've been paying last year. So the amount, I guess it would have been in 2016 that we would have entered into the last 3-year agreement. That agreement was a fixed dollar amount, and then that's been inflated by the CPI each year. And that same thing happened 3 years prior to that. So as it says in the staff report, it was 2009 was the last time an actual study was done, and that's why we feel like it's time to make that investigation again.
I agree, and thank you for answering my questions, and you obviously know this really well, so I appreciate that.
Building on that one question, though, the flat fee, in 2020, it says that the amount budgeted is $454,000. So that doesn't reflect on whether we have one prisoner from the city or 100. We're going to get $454,000. Is that, it's not a per inmate charge?
It is not a per inmate charge. I cannot foresee a situation where we would ever have only one city prisoner. But yes, it is based on that historic number, and that's why it needs to be updated. Commissioner Shadwick made reference to the Jail Population Reduction Committee, and both the county and the city have worked really hard on trying to make sure that the numbers of folks that are being held in custody are appropriate and as, essentially as low as is warranted by public safety. And so that's really one of the things that's driving us to say, well, it's time to revisit this charge, is because all that has occurred in the last 10 years, and we don't know, have there been meaningful impacts on the number of city prisoners versus county prisoners?
Well, obviously, it was overdue to study this, so.
Right.
Any other questions or comments from commissioners? Is there any public comment? Seeing none, I'll bring it back to the commission for action.
Mr. Chairman, I move we approve by signature the interlocal agreement with the City of Salina for jail services as requested.
Second the motion.
It's been moved and seconded that we approve RFA 134-20, interlocal agreement with the City of Salina for jail services. Further comments? Not, all those in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Thank you, Phil. Item number 7.
County Administrator's update with Philip Smith Haynes, County Administrator.
Okay, it's yours again, Phil.
Thank you. There were 3 items that I wanted to mention today. First off, regarding legislation, I did attend Salina at the State House last Thursday along with Chairman Vidrickson. Senator Hardy and Representative Johnson spoke to us at lunch. I also had a meeting with a representative from the Hayes area in the afternoon when we had a little bit of free time. We received presentations from KDOT, the Department of Commerce, and the Governor's Military Council. And I've talked with our road and bridge staff about some ideas that were generated by that KDOT presentation. Also on Saturday, I attended the legislative coffee here in town at the chamber, along with our county appraiser and the county sheriff. Senator Hardy was again in attendance, along with Representatives Dirks and Clays. And it was an interesting forum. It was the first time I'd been to one of those in Salina. There was a lot of good discussion. Also received the regular legislative updates from both the Kansas Association of Counties and the League of Kansas Municipalities. The upshot of all of that, what we heard when we were in Topeka, what we heard on Saturday from our local representatives, and what we've received from our statewide association is that there's not a lot of action at the present time in Topeka because the move to put a constitutional amendment on the ballot did not receive sufficient votes in the House. The reaction to that has been for leadership in both the House and the Senate to really limit the amount of discussion and debate that's occurring on the floor. So that in particular has affected Medicaid expansion. Read you a quote from what the Association of Counties said this last Friday. With the constitutional amendment regarding abortion still hanging out there, as well as Medicaid expansion, it is unclear what, if anything, will move next week, meaning this week, on either side of the rotunda. Of course, this only affects bills that are not exempt. Bills that have been through tax, Senate Ways and Means, Appropriation, or other exempt committees are not affected. So bills like SB 294 and HB 2563 are not affected by this deadline. HB 2563 is the Tobacco 21 legislation. SB 294 is the one that I referred to last week, which is attempting to repeal the tax lid now. That got amended into it, but move cities and counties into a new lid, essentially, that's based on a model out of the state of Utah. The big concern that the state and local representatives have on that is that it does not provide for growth. And so that's something that we're continuing to track. But this week is turnaround in the legislature, so theoretically anything that came through a non-exempt committee should have a floor debate in its House of Origin by the end of this week and either live or die. The second thing that I wanted to talk about this morning is just a reminder that 2020 is the year of the decennial census. April 1st is the day that we all get counted at our place of residence. And that the census numbers, of course, are important for everything from redrawing the district lines for county commissioners to determining federal funding that comes to states and local governments. Info about the census will be mailed out starting approximately March 12th this year. And this is the first time that most responses to the census will be in electronic form. So just remind folks that it is safe, that information is not used for other purposes per federal law, and that it is critical for folks to respond when they get their census information because it does determine funding. Last but not least, A reminder on our 2 upcoming town halls on the jail, 2 more opportunities for folks to learn more about the jail project. The first will be this Thursday, 6 p.m., the K-State Polytechnic College Center at 2310 Centennial. And then on Thursday, March 19th at 6 p.m., we will be at the Salina South High School Commons area. That is what I had for this morning. Be happy to answer any questions.
Do you have any flyers available for Thursday's event?
I do. I have some
Okay.
on my desk. I'll be happy to give them
Yeah,
to you.
but just remind me before I leave.
Will do.
Any other questions? We'll move to, thank you, Phil. We'll move to item number 8.
Commissioners' comments.
And I will start that by saying that Phil has already stolen some of my thunder here, but I attended the Airport Authority meeting last Wednesday, and I think the big news coming out of the airport is that beginning, I believe it's March the 6th, that Salina will now have nonstop service to Denver. They have excluded the Hayes portion of that stop, and that has been well received. They are also getting an earlier flight from Chicago and return to Chicago, which will allow anyone leaving Salina would be able to make an East Coast connection all in the same day. So that's pretty significant news. And to show you how that's been approved or, accepted by the public, 85% of the flights on that weekend, March the 6th and 7th, which there's 2 planes, 50 passenger planes, so that's 100 seats. They're 85% full right now this was as of a few days ago. So it's pretty well accepted, and it's a big step, with a lot of collaboration from the Airport Authority and the state and United Airlines and Gary Doss, who's their contact there. So a lot's being done there. Also, as Phil stated, Salina at the Capitol, KDOT, Military Affairs, Department of Commerce, etc. He told you who we visited with. I also met with Representative Concannon from Mitchell County and Representative Carlson from Clay County, because they're members of that 2nd district, which the state has 6 districts. And so I wanted to voice my displeasure, my personal displeasure with Senate Bill 294. And the taxation levels and so on that's in that bill. So if it should come out of the Senate, I was lobbying them to vote against it, mainly as a citizen, but also as a 1 vote for the county commission. I think that's the way to look at it too. So Friday, I was attended the KAC governing board, which is a board that meets all day long in Topeka. We heard a lot of legislative updates, conference planning for next year's KAC conference, and those types of things. So with that, I will yield to anyone else who has any announcements or questions. Other business? Nope. I will take a motion for adjournment.
So moved.
Second.
Been moved and seconded that we adjourn today's meeting. All those in favor say aye.
Aye.
Aye. Opposed, same sign. We are adjourned. We will follow with a short meeting update in room 107B in approximately 5 minutes. Thank you.